Hello everyone, my name is Glenn Davidson and I am a nurse working in the neonatal intensive care unit and a current student at Purdue University Northwest, earning my bachelor's in nursing degree. For my nursing informatics course, I was asked to creatively propose a manual nursing process into one involving technology that will improve the way we do nursing. One of the common issues that we see within the neonatal world, and especially amongst premature infants, is necrotizing enterocolitis, which is also known as NEC. Within this video, I will be proposing a NEC risk assessment tool that will be embedded into the electronic health record. To start off, what is NEC? Necrotizing enterocolitis is a common disease of the intestinal tract that affects the neonatal population, primarily those born premature, less than 32 weeks gestation. NEC causes the tissue lining of the intestines to become inflamed, die, and potentially slough off, increasing the risk for death. According to the National Institute of Child Health and Human Development, the common symptoms of NEC are poor food intolerance, abdominal distension, stomach discoloration, bilious emesis, bradycardia, apnea, desaturations, abdominal tenderness, and guarding, bloody stools, and peritonitis due to perforation of the intestines. The severity of this disease is significant due to the vulnerability of the premature infant population, and when NEC is suspected, clinicians perform an abdominal X-ray and blood tests. Now that you know a little bit about NEC, next that I want to talk about is the problem that I'm trying to address. Since necrotizing enterocolitis is a disease that suddenly occurs with little warning and progresses at a fast rate, early detection and diagnosis are vital. However, there is a deficit in interventions and strategies that promote the early detection of NEC despite it having such a high prevalence and high mortality rate among the premature neonatal population. There needs to be an intervention such as a NEC risk assessment tool that can make sure clinicians are able to diagnose and intervene quickly to prevent infant death. As I said earlier, to combat this problem, I am trying to propose the implementation of an embedded risk assessment tool. A NEC risk assessment tool is used to evaluate an infant's risk factors such as their gestational age, race, type of feeding that they're receiving such as formula and breast milk, whether they are receiving probiotics, or whether they have a history of being transfused with packed red blood cells, and etc. This guides clinicians to decide if they need to keep close observation or intervene to prevent the progression of NEC. At the end of this video, I will display an example of a risk assessment tool known as Gut Check from Gephardt of the University of Arizona. Gut Check NEC demonstrated the best prediction of NEC leading to death or NEC leading to surgery. Therefore, the implementation of a risk assessment checklist would improve nursing awareness and early diagnosis rates and further prevent infant deaths. Similar tools available are NEC and NeoNeeds. These are both risk assessment checklists, and they both are assessed for the risk for NEC. Embedding a NEC risk assessment tool, such as the one described, would allow healthcare professionals, especially nursing staff, to monitor infants at higher risk more closely due to the tendencies of NEC. Integrating the tool within the electronic health record provides for easy access to the checklist, reminds staff to assess for NEC, and based on their risk score, notifies them of those who need extra close monitoring. The goal of this intervention is to decrease the infant mortality rates due to NEC, improve the early diagnosis detection, and intervention of NEC in the neonatal population, improve the prognosis of infants with necrotizing enterocolitis due to early intervention, and lastly, improve the safety and quality of care for the premature neonatal population. In conclusion, NEC is affecting the lives of so many infants and their families. Being such a common disease among the neonatal population, there should be more strategies and interventions to prevent its prevalence. The integration of a NEC risk assessment tool into the electronic health record has the ability to decrease the rate of NEC cases, improve the infant mortality rate, and improve early diagnosis and intervention. What I hope to convey through this art piece that I am currently creating is that with the implementation of an embedded NEC risk assessment tool, we will create a wall of prevention in order to protect our newborns, especially those born premature, from the horrible disease that we call necrotizing enterocolitis, and furthermore, improve the quality and safety of care of our neonates. Thank you so much for watching. Enjoy the rest of the video, and at the end, once again, I will have the NEC risk assessment tool from Gephardt of the University of Arizona, as well as my references. Thank you.